When your patients are hurting, when they're sick, when they need your care, how can you help them if they can't get to you? There are thousands of people in dozens of towns right across Ontario who put their lives on hold just to see their doctor.
He had to sit in the car for an hour and a half and suffer with this nausea and with this sickness and so on.
We can't take time off to go to work to go spend 2 months down there, and she can't afford to stay 2 months in Toronto.
Sometimes I have to go the day before and rent a motel room to, be there in time.
Finally, the access to health care that patients so desperately need is as close as the local hospital or clinic, thanks to the Ontario Telemedicine Network, connecting patients to care from all across Ontario. Tom Frederick runs his own carpentry shop in the small northern town of Powassan. Awaiting a kidney transplant, Tom needs to routinely meet with his doctor, who is over 2 hours away, to have his kidney functions monitored.
I'm running a business and I'm self-employed, so every hour that I'm not working is dollars and cents out of my pocket and out of my family's mouths, basically.
Thanks to the Ontario Telemedicine Network, Tom's doctor visits don't cause him financial hardship.
I go up there, I'm there 15 minutes before my appointment. I go in, they take my vitals, I sit down, I conference through video, television with my doctor in Sudbury, Dr. Mehta. When the appointment's over, get in the car, come back home, get changed in my work clothes, and I come back out to work. I've lost maybe 2 hours out of my work day I lose, which is nothing compared to losing an entire day, or sometimes 2 days.
These are retirees Eugene and Joyce Spilchuk of North Bay.
There are some cottages on the islands there, yes.
Eugene is recovering from cancer and needs to drive a 3-hour round trip to Sudbury for regular checkups with his medical oncologist, Dr. Pablo Cano.
For patients who have to travel 6-7 hours, and in the wintertime, sometimes dangerous driving for an interview, particularly when things are going well. So I feel uncomfortable with that.
Okay, Mr. and Mrs. Spilchuk, sign in, please.
Thanks to OTN, Eugene can see his doctor from an OTN video conferencing clinic just minutes from his home. And best of all, Joyce can be there with him.
I feel it is very important for me as his wife to be there to listen to what the doctor has to say, because when a person is sick, they don't grasp everything.
There might be some things that I forget. I am forgetful, so she'll probably help me out that way.
The expression on his face gives you the confidence that when he's saying everything is fine, you know that things are okay.
Dr. Elizabeth Tullis has over 350 cystic fibrosis patients registered in her Toronto-based clinic, 3/4 of whom come from outside the GTA.
Usually people with CF are seen 4 times a year, so that's every 3 months. But if they have particular problems such as they're underweight, or they're waiting for a lung transplant, or they're pregnant, we would see them every month and sometimes more frequently.
It was Julie's pregnancy that complicated matters for the 19-year-old from Sudbury. But it was the premature birth of her son, Blake, that made the situation desperate.
We would have had to have taken her away from her premature child to bring her down to Toronto for a visit. And, that would be less than ideal.
Fortunately for Julie, Dr. Tullis uses OTN as an integral part of her practice.
The video conferencing let me stay in Sudbury with my son after he was born premature. And it's also better for my family because then they don't have to all pack and come see me in Toronto.
So it was really an example of sort of the win-win situation of telemedicine. In the past, we dragged people all over the province in order to make sure they were okay.
Julie didn't have to go to Toronto, Blake didn't have to go to Toronto, and also I knew that if we need anything, we could use a teleconferencing to talk to the doctors in Toronto, which is much easier for the family.
OTN sites are local and accessible to patients all across the province. Thanks to the commitment and innovation of our partner organizations and healthcare providers, there is at least one OTN telemedicine studio available in every hospital in Ontario. And the network continues to grow, including cancer centers, public health units, long-term care homes, and specialists' homes and offices. Access to quality healthcare has never been so easy.
We connect patients and providers across the province, eliminating the barrier of distance and time.
Telemedicine really puts people together so that they can understand the problems, solve the problems, and discuss the issues. And really, in many cases, it is truly a replacement for that face-to-face encounter.
Having the video conference in North Bay is just like being in Sudbury.
It's very convenient. I mean, why waste your time driving, especially with gas prices now? Stay here, do it, go back home, it's all done.
Patients love it because they can have access to healthcare right in their home community. Providers love it because they can access care for their patients. They can provide access to a specialist, and they can provide care more easily themselves.
I'm getting the best possible medical advice and care that I can get without actually being right there. Works for me.
The future of healthcare is now. At OTN, we have the resources to provide healthcare access to virtually any patient, anywhere, at any time. We are the Ontario Telemedicine Network, making the connection for health.